Today, we are going to talk about a condition that slowly causes serious damage inside the body: high blood pressure, a condition many doctors refer to as a silent killer. High blood pressure, also known as hypertension, is a condition in which the force of blood flowing through the arteries is higher than normal. For a healthy adult, a blood pressure reading of 120/80 is considered normal. However, when blood pressure consistently remains at 140/90 or higher over a long period of time, it is diagnosed as high blood pressure. The most dangerous aspect of high blood pressure is that it often causes damage without showing any obvious symptoms. People may feel completely normal, while internally their heart, brain, kidneys, and blood vessels are being gradually damaged. So, why is high blood pressure so dangerous? From a scientific perspective, persistently high blood pressure places constant extra stress on the walls of the blood vessels. Over time, this pressure damages the delicate inner lining of the arteries. In response, the body begins to deposit fat and cholesterol at the damaged sites. This process is known as atherosclerosis. As these fatty deposits build up, the arteries become narrower and stiffer, restricting normal blood flow. This is where the risk of heart disease and stroke begins. Let's first talk about heart disease. When a person has high blood pressure, the heart is forced to pump blood with much greater effort than normal. Day after day, this increased workload causes the heart muscle to thicken. Initially, this may seem like an adaptation, but over time the heart becomes weaker and less efficient. Scientific studies have consistently shown that as blood pressure increases, the risk of heart disease rises significantly. Even individuals with mildly elevated blood pressure face a higher risk of heart attack and heart failure. High blood pressure can also cause the arteries that supply blood to the heart to become narrow. When one of these arteries suddenly becomes completely blocked, a heart attack occurs. In many cases, people are unaware that they have high blood pressure, and the very first warning sign appears as a heart attack. Now, let's turn our attention to stroke. In medical science, high blood pressure is considered the single most important risk factor for stroke. The blood vessels in the brain are extremely delicate. After years of exposure to high pressure, these vessels may either weaken or develop blockages. As a result, two main types of stroke can occur. The first is ischemic stroke, which happens when a blood clot or fatty deposit blocks blood flow to the brain. The second is hemorrhagic stroke, which occurs when a weakened blood vessel in the brain ruptures due to excessive pressure, leading to internal bleeding. Scientific research shows that the longer a person lives with high blood pressure, the greater their risk of stroke becomes. After 5 years, the risk increases. After 10 years, it rises even further. And after more than 20 years, the risk can reach a critical and life-threatening level. The most important thing to understand is that these risks do not develop suddenly. They build silently and gradually over many years. High blood pressure causes internal damage that cannot be felt in a single day. But one day, the consequences appear suddenly, in the form of a heart attack, a stroke, or sudden loss of consciousness. The good news is that strong. Scientific evidence shows controlling blood pressure can significantly reduce these risks. When blood pressure is lowered, stress on the blood vessels decreases, the heart can function more efficiently, and blood flow to the brain remains stable. Research has shown that even a small reduction in blood pressure can greatly lower the risk of heart disease and stroke. That is why doctors emphasize that high blood pressure is not a minor condition. If ignored, it can put a person's life at serious risk. In the end, one thing is clear: high blood pressure is not just a number. It is directly linked to your heart, your brain, and your future. Becoming aware and taking action in time is the most powerful form of prevention.